We have now passed a significant and unfortunate milestone. According to CBC's COVID-19 case tracker, there are now more than 1 million confirmed cases of the virus in this country, specifically 1,001,651 and counting. In addition to that 1 million cases, there are also now more than 23,000 deaths being attributed to the virus. CBC News' chief medical contributor, Dr. Peter Lynn, says it is both tragic and disappointing that we were not able to protect our most vulnerable.
Number one is all the suffering that went on and the patients that passed away. So therefore, all the families that are suffering with people that have gone. So we will never get them back. So for them, it'll never go back to normal, even though we're all trying to strive for normal. But that 1 million also tells me that we have helped the virus 1 million times at least. Because remember, this virus cannot move on its own. It needs us to move it to the next person, and it needs us to breathe it out, and the other person has to breathe it in. And it needs us to make photocopies of itself. So it needs us for every single step. And what this tells me is that 1 million times we have offered our assistance to this virus.
For more on this story, I'm joined now by Dr. Michael Warner. He is the Medical Director of Critical Care at Michael Garron Hospital, and he's joining us from Toronto. Dr. Warner, I know it's been a long and difficult day for you. Thank you so much for joining us.
Thanks for having me, Natasha.
So, Dr. Warner, I just want to bring folks at home up to speed because we actually had you on the show earlier in the day. You were speaking with my colleague, Michael Serapio, and you gave this incredibly powerful story of one of your patients struggling with COVID-19. I was watching at home. I had to stop what I was doing to listen, and I just want folks at home to be reminded of what you talked about. Let's take a listen now.
One of my patients, her husband was forced to go to work at a factory that had an outbreak because it wasn't on his shift. He didn't want to go to work, but he doesn't have any paid time off for sick leave unless he gets COVID. Well, guess what? He got COVID, the variant, and so did everyone else on his shift. And yesterday, I sent her to a quaternary care center to be on a heart-lung machine. I've never had a patient so close to death in my career. It took 5 doctors, actually 17 people yesterday, to keep her alive. And she may still die. And she's in her mid-40s, and that didn't have to happen.
Dr. Warner, I understand that you issued an update about that patient just a short while ago. Can you please tell us what happened?
Yeah, so our patient, because this is a patient share between my team at Michael Garron Hospital and the team at Toronto General Hospital, has died, and I can tell you that both teams are severely affected by this, as is her family, who I've spoken with. Natasha, they didn't get to see her from the moment that she entered the hospital. They'll never see her. And the closest they got was a Zoom meeting while she was in the prone position on a ventilator. That's the closest they got. And then the updates from me multiple times a day. And, when I listened to myself being interviewed earlier today, I could tell how angry I was. And I think I'm beyond angry now. I'm just so sad. And her story is so important, but unfortunately, it's not unique. And until we acknowledge that certain people are getting killed by this and certain people just want to live their lives because they're not at risk, and we need to square that circle and move forward together, we're not going to move forward. We need to stop everything and focus on protecting the people who are getting sick from this. It's just the humane thing to do.
Dr. Warner, can you tell me, as much as you feel comfortable, what that conversation was like with your patient's family?
I mean, they have never met me, Maybe they've seen me on TV, but they've never met me. And they trust me they trusted me to save her. And from the moment that I told them that she had to be intubated, to the moment that I told them she had to be prone, that means put on her belly, to the moment I said that I need to send her somewhere else because I can't help her, they trusted me. And even on that day that we put her on the heart-lung machine, which is also called an ECMO machine, they trusted me because we brought the paramedics to our hospital to bring her to Toronto General, but she was too sick to go there. So the paramedics went to Toronto General and picked up the team from that hospital who came to my hospital. 2 surgeons, 2 other intensivists, 3 paramedics, a perfusionist. There were 17 people. And like I said before, we almost lost her. And then, they had to hand over their trust to a new team at Toronto General. And then I spoke to them today after she died. I mean, it's such a crazy circle, and it's just so sad. And I'll never meet them, but I will never forget her.
Tell me what you know about her.
Well, I won't say anything that will identify her. I just know that she doesn't look like me. She's a racialized Canadian who's in her mid-40s, who has a family, and whose husband is working very hard to provide for his family, whose daughter spoke the best English of their family, who I tried to update most consistently and translate to her father. And their life will be forever altered by this experience.
So I'm sorry, I'm having a hard time with this too, and I'm not nearly as close to this as you are. So when you compare your anger from earlier today and how sad you're feeling now, what's the action that needs to be taken?
Well, we need, my father who's watching always says you turn a knock into a boost. And, we can't, her memory has to be a blessing, and it also has to be an inspiration. We got to take the politics out of this. We need to galvanize us as a society. It's not about lockdown or not. It's not about this or that. It's about protecting people who keep us going, bringing the vaccines to the factories. Like, everything else needs to stop. Only the people who are truly essential should be working, and we should do everything to protect them, and everyone else should stay at home. Wave 3 is a different disease. As I said before, I am fearful of this, and I don't get scared of things easily. I have patients right now, and I'm at work right now, in their 20s, in their 30s, in their 40s, with COVID-19 in my ICU today, with no risk factors, who are just doing their job. We have to acknowledge the moment that we're in. The vaccines are coming, but they're not here yet. So we need 1-2 months, I don't know how long it will take, to focus. Vaccinate everybody in Scarborough, everyone in Peel, everyone in North Etobicoke, everyone in Jane and Finch, everyone in Thorncliffe Park, because that's where the people live who are dying.
Dr. Warner, I don't know if you know this, but between the time this day that you lost that patient and you and I speaking now, Canada crossed the threshold of having 1 million confirmed cases of COVID-19. We got the numbers out of British Columbia. They put us over the 1 million mark. Neither one of us wants to be in the business of counting numbers like that, but it is a significant threshold that we've crossed, and I wonder what goes through your mind when you hear that number.
What goes through my mind is why I'm doing this interview right now, because those numbers mean so much more when you talk about a person who is one of those numbers, and a family who will never have that person back in their life. We're immune to what those numbers mean because I don't even know what they mean. But these are real people who are 4 floors below me right now, struggling to breathe, whose families are at home, who I call every day, who ask, can I have a Zoom meeting today? And they just watch their family members on a ventilator not interact with them. The public can't appreciate this because we're not very good at letting them in. So I'm trying to let people in. This is real. It's not about fear mongering. It's just about acknowledging that this is real and people are really suffering. Businesses are suffering, but life is a finite journey and it's ending for too many people too soon. And they're very young. And we just need to focus on health right now. The economy will come. So back to your original question, the numbers are important, but the people behind them, we should never forget.
You said there, sir, that those of you on the front lines who are dealing with this are not particularly good at letting the rest of us in. Why do you think some of your colleagues are not letting us in, the rest of us? And do you think it's going to change?
Well, part of it is we're really busy, really busy. But I'm trying to. I've been doing this media thing for a year just because I can't stop because the message needs to get out. And something came to me. I said, if I can tell the patient's story, maybe people will listen. So I asked this family of my patient that we're talking about, can I tell her story? Because I think that will change the trajectory for our essential workers in Ontario if people actually acknowledge or understand what happens. So I heard the story and they let me tell it. And it's because of them that so many people are watching and this is hitting them. And I keep asking patients' families if I can tell their story, and no one has said no yet. And as long as I do it in a way that doesn't identify them, it's a way for me to make it real, because we can't bring people into the ICU because of COVID restrictions, etc. But at least I can tell the stories and people can make that emotional connection with the patients that I've met, but they haven't.
Dr. Warner, before coming on air with us, you tweeted that you were going to join us this evening and talk about this story. And I had the opportunity to see some of the responses to your tweet. And so many people were not only thanking you for your work, but also almost pleading with you, please, please get this message out. We need you to say what you're saying. Does that at sometimes become too much on top of the work you already have to do, which is overwhelming? I mean, if that many people were saying to me, I imagine on a pretty regular basis, please, please help us, it would become overwhelming. How do you deal with this?
My motivation comes from within. When you see, and that's not to say that I don't appreciate the messages, because I see them all. I see the good ones, I see the mean ones, but I try and remember the good ones. But when you're a doctor, especially an ICU doctor, we don't do preventative medicine by definition. We deal with people and help them during the final stages of their life and try to save them. But I want to be able to have some influence over what happens beyond the walls of the ICU, so I don't have to keep having those phone calls with patients' families, so those Zoom meetings can stop, so everyone can return to the life they had before. And so it's a privilege to be able to tell these stories. It's a responsibility. As physicians, we're supposed to be patient advocates as much as we're supposed to be experts. And so everyone can choose to advocate in their own way, and this is the way I've chosen to do it.